Hello and welcome to my channel. This is Urban Diet and Health, and today we're looking at gastrointestinal diseases. GERD, diarrhea, and colorectal cancer are examples of gastrointestinal diseases. When examined, some disease show nothing wrong with the gastrointestinal tract, but there are still symptoms. Other diseases have symptoms, and there are also visible irregularities in the GI tract. Most gastrointestinal diseases can be prevented or treated. Gastrointestinal diseases affect the gastrointestinal tract from the mouth to the anus. There are two types, the functional and the structural. Some examples include nausea or vomiting, food poisoning, lactose intolerance, and diarrhea. So, what are functional gastrointestinal diseases? Functional diseases are those in which the GI tract looks normal when examined but doesn't move properly. They are the most common problems affecting the GI tract, including the colon and the rectum. Constipation, irritable bowel syndrome, nausea, food poisoning, gas, bloating, GERD, and diarrhea are common examples. Many factors may upset your GI tract and its motility, that is, ability to keep moving. Such factors including eating a diet low in fiber, not getting enough exercise, traveling or other changes in routine, eating large amounts of dairy products, stress, resisting the urge to have a bowel movement, possibly because of hemorrhoids, overusing antidiarrheal medications that over time weakens the bowel muscles and movement called motility, taking antacid medicines containing calcium or albumin, taking certain medicines, especially antidepressants, iron pills, and strong pain medicines such as narcotics, and finally pregnancies. What are structural gastrointestinal diseases? Structural gastrointestinal diseases are those where your bowels look abnormal upon examination and also doesn't work properly. Sometimes the structural abnormality needs to be removed surgically. Common examples of structural GI diseases include strictures, stenosis, hemorrhoids, diverticular diseases, colon polyps, colon cancer, and inflammatory bowel diseases. So let's examine some GI diseases. For one, constipation. Constipation is a functional problem, and it makes it hard for you to have a bowel movement or pass stool. The stools are infrequent, less than 3 times a week, or incomplete. Constipation is usually caused by inadequate roughage of fiber in your diet or a disruption of your regular routine or diet. Constipation causes you to strain during a bowel movement. It may cause small, hard stool, and sometimes anal problems such as fissures and hemorrhoids. Constipation is rarely the sign that you have a more serious medical condition. You can treat your constipation by increasing the amount of fiber and water to your diet, exercising regularly and increasing the intensity of your exercise as tolerated, moving your bowels when you have the urge. Resisting the urge causes constipation. If these treatment methods don't work, laxatives can be added, but note that you should make sure you are up to date with your colon cancer screening. Always follow the instructions on the laxative medicine as well as the advice of your healthcare provider. Secondly, let's look at irritable bowel syndrome, known as IBS. It's also called spastic colon, irritable colons, IBS, or nervous stomach. IBS is a functional condition where you have colon muscles contract more or less often than normal. Certain foods, medicine, and emotional stress are some factors that can trigger IBS. Symptoms of IBS include abdominal pain and cramps, excess gas, bloating, change in bowel habits such as harder, looser, or more urgent stools than normal, alternating constipation and diarrhea. Treatment of IBS includes avoiding excessive caffeine, increasing fiber in your diet, monitoring which foods trigger your IBS and avoid those foods, minimizing stress, or learning different ways to cope with stress, taking medicines as prescribed by your healthcare provider, avoiding dehydration and hydrating well throughout the day, getting high quality rest and sleep. Number 3 condition is hemorrhoids. Hemorrhoids are dilated veins in the anal canal, structural disease. They are swollen blood vessels that line your anal opening. They are caused by chronic excess pressure from straining during a bowel movement, persistent diarrhea, or pregnancy. There are 2 types of hemorrhoid: internal and external. Internal hemorrhoids are blood vessels on the inside of your anal opening. When they fall down into the anus or as a result of straining, they become irritated and start to bleed. Ultimately, internal hemorrhoids can fall down enough to prolapse, that is, sink or stick out of the anus. Treatment of internal hemorrhoids include improving bowel habits, your healthcare provider using ligating bands to eliminate the vessels. Your healthcare provider can also remove them surgically. Let's look at external hemorrhoids. External hemorrhoids are veins that lies just under the skin or on the outside of the anus. Sometimes, after straining, the external hemorrhoid veins burst and a blood clot forms under the skin. This very painful condition is called a pile. Treatment includes removing the clot and vein under the local anesthesia or removing the hemorrhoids itself. What are prevention? Many diseases of the colon and rectum can be prevented or minimized by maintaining a healthy lifestyle, practicing good bowel habits, and getting screened for cancer. Common symptoms include a change in normal bowel habits, blood on or in the stool that is either bright or dark, unusual abdominal or gas pains, very normal, very narrow stool, a feeling that the bowel has not emptied completely after passing stool, unexpected weight loss, fatigue, and anemia. Thank you very much for staying with us. This is Urban Diet and Health. Do like and subscribe to our channel as we bring you more valuable content. See you in the next video.